Welcome back to the Lung Cancer Network. Today's Facebook Live is going to be on palliative care. I'm Katie with Live Lung, and I am so happy to be joined by Nurse Navigator Angie. Yay! Need a little button to push that. I'll get one day. Angie is going to be here to discuss an important topic with us, and it's going to be on palliative care. So for those who may not be familiar, a nurse navigator is a healthcare professional who helps to guide a patient and their families through all the complexities of the medical system. And they make sure that the patient has all the support and resources and education that they may need. Today, we're focusing on palliative care, and that's a specialized type of medical care focused on improving quality of life for people that face serious illness. Now, there can be a lot of misconceptions around palliative care, and I'm so happy that we're talking about this today, and I'm so happy, Angie, that you are going to shine the light on palliative care. So talk to us about your experience with palliative care and how it differs from other types of care, like maybe hospice.
Having done hospice as well as palliative care, there's two big differences, and I enjoyed working with patients on both spectrums. Hospice is more focused on end-of-life care. It can be any illness, any terminal illness, with a non-curative intent. Someone who knows that they're not going to be taking medication or treatment. In a lot of cases with our population, chemotherapy, immunotherapy, or radiation. When they have exhausted those efforts or chosen not to pursue more treatment, they might take hospice into consideration. Hospice is usually a group, multidisciplinary group that comes to your home, assesses your needs. Their focus is comfort, quality of life, improving the well-being of not just the patient, but the caregivers, the family that are dealing with the life-limiting illness. It is covered by Medicare, Medicaid, private insurance. No person is ever turned down. There are guidelines to be met. So that is one focus that patients have an option for, and very different from palliative care. And people so often mistake one for the other. Palliative care can be useful to a patient at any stage of any diagnosis where they need a type of treatment. For instance, a patient getting chemotherapy and immunotherapy, radiation, that is often a treatment we give for stage 3 lung cancer. And this is with curative intent. When you have stage 3 with this particular treatment, it's a 6 weeks long treatment. And some patients get esophagitis, nausea, vomiting, fatigue, struggling with appetite, depression. So when you have those issues, you can have palliative care come in, work with symptom management, trying to manage all those symptoms to keep the patient as healthy as possible while undergoing treatment, also to improve their well-being and quality of life. It also helps the family, supports the family with nutritional needs, with helping rescue those symptoms when they're at home and alone with the patient. But it is certainly, palliative care is to control those symptoms. And it can be a part of any stage. Sometimes people who have surgery to remove early stage lung cancer might struggle some afterward. If you're helping make those symptoms better or that pain control better, whatever the case, that is palliation of symptoms. Very different than hospice care.
I appreciate that definition. I know that when my dad was initially diagnosed, he was offered palliative care, and that was, in essence, hospice care. So what's different in terms of hospice care and palliative care?
Hospice care really focuses more on comfort measures for those who have decided not to pursue any further treatment. Focus is quality of life, and typically in a hospice situation, that is looking at a six month or less prognosis. Not to say some folks might outlive that 6 months, but when a doctor has, exhausted efforts, or if a patient chooses at their will to, forego further treatment, it's life limiting and it's that 6 month prognosis. Whereas palliative care, there is no prognosis focus as much as it's focusing on the side effects of treatment, trying to alleviate those side effects, improve those side effects. Doesn't matter what stage of the cancer diagnosis you are in, anyone can use palliative care to alleviate or comfort their systems. The focus is not on goals of care so much as hospice is. The focus with palliative care is staying, improving quality of life, improving well-being. It focuses more of a holistic approach for a patient, looks at the physical, emotional, spiritual, and psychological impact that not only the cancer diagnosis has, but the treatment itself impacts the patient. It also impacts the family. So palliative care can be so beneficial at any stage, getting them involved for the family's sake as well as that of the patient. It takes part in the cancer center. It can be available in a patient's home. I actually have patients that if they live a long distance away, they'll do virtual visits. And it's just such a great source of support when undergoing any treatment for a chronic or terminal illness.
So you've been diagnosed. You've heard a little bit about palliative care, maybe from this Facebook Live. How do you get palliative care? Is there a palliative care hospital? Is it through your hospital? Is it something that you seek out on your own?
So certainly you can self-refer. Most doctors have no problem referring a patient to any type of palliative care program. Most of the time they will have them in the county. For instance, we live in Forsyth County. We have a great palliative care hospice organization here local. We also, in the particular hospital I work in, we have an inpatient palliative care team that also provides outpatient care, so that, if someone's inpatient, they're diagnosed or they start treatment as an admitted patient, we can get the palliative care team involved then, and they can follow them once they are discharged from the hospital and have outpatient treatment. If it is in the community and a patient or a caregiver decides that they could use that extra support for any terminal or chronic illness, and I know we're focusing on lung cancer, of course, but if any illness that's chronic or terminal, you can self-refer. You can call up hospice or call up palliative care in your community. They will come out, they will evaluate your needs and let you know the best resources to support you guys in the home. Most any hospital or cancer center is going to have access to hospice or palliative care. Now, given that, taken into account that you have some very rural areas. In those instances, the virtual visits, video visits, may be your best recourse, but they are available. It takes internet and a little bit of know-how with emails and team meetings, but they will find a way to reach out.
I love how much the televisits, the telemedicine has opened it up for folks who
It
might
has.
otherwise, not have access. So, what kind of support services are within palliative care? I know that there are things like maybe a pain management specialist, maybe physical therapy, but what else is included in palliative care?
So that's a great question. In the instance, I guess the organization I want to say, the organization I worked with here, local in Forsyth County, we worked very closely with dietitians, social workers, chaplains, counselors. We had more holistic type, such as massage therapy, integrative health. Not so much physical therapy in the home because that was a little different than what you would do in a long-term hospice situation or palliative care. Now, in the inpatient world and in the outpatient cancer center where I now work, we have all of those resources as part of palliative care. Again, dietitians, you're looking at the patient's nutritional well-being. You're helping support the caregiver with what do I give this patient? How do I best care for my loved one and make sure they're eating right? We have great counselors, the greatest team of chaplains. We have resources coordinators, social workers. There's so many things that can go awry when you're going through treatment. And these guys focus on financial resources, not, nutritional resources. They look at the spiritual and the psychosocial impact that a terminal illness such as lung cancer can have. So in either hospice or palliative care, you have this entire multidisciplinary team who are focused on your needs, but they're looking at you as a whole. They're not just focused on that cancer or those lungs or where the cancer is impacted. They are looking at the entire person. We are lucky to have a great integrative health program where I work. It involves everything from acupuncture to massage therapy, yoga, meditation, light physical therapy, exercise therapy. We have a gym that is specific to our cancer patients, very light exercises that have physiologists that actually evaluate each patient, whether they're going through treatment, whether they're stage 2, stage 4, if it's impacted their brain, their bone, if it hasn't impacted anything but just one lobe of the lung. These physiologists will assess and evaluate that patient's abilities and do an individual program for that patient. That is huge, especially for patients who are young or super active, have to keep up with their kids and grandkids or still want to work full time. These programs are essential to a patient's well-being and keeping that quality of life at a maximum level. That's the most important thing.
So I have a question, and you may not know the answer to this, but do all hospital systems have a palliative care team?
They should have a palliative care team. I work in a community hospital, having come from a large academic cancer center. Of course, you have both in those types cancer centers. In the rural area, again, it can be a little tricky. You may not have as good of access. My father grew up in a small town in the mountain area, and I believe the closest hospice palliative care was about 45 minutes away. They still should come assess your needs in the home, and they find a way to work around that distance. And often you'll see folks think, well, this is too far out for me. They will never come to my house. Literally, palliative care as well as hospice, they will find a way to get to your home to meet your needs, even if sometimes it's video visits. If you can't make it to their center, or if you're not coming to town, I've seen them do all kinds of things to be creative, especially since COVID, to make sure they're able to evaluate and assess the needs of those patients and their caregivers. I always add the caregivers get as much from palliative care and hospice as the patients do. It is so vital.
Absolutely, absolutely. That's good advice. So, some of the things that I have heard, And we hear a lot as patients, as survivors, about the benefits of, maybe supplements or exercise or, massage and acupuncture and alternative treatments. Doing those types of activities under the watchful eye of palliative care, are they experienced with those types of activities and cancer patients? Are they talking to your oncologist? Do you still have the same oncologist? Walk me through what an average scenario might look like.
Okay. So you have a patient that comes to palliative care and say they're having a lot of symptoms. I'm going to use a patient who is stage 3. You give stage 3 treatment for lung cancer with curative intent. We want to put it in remission. That is our intent. But they're having a lot of symptoms. So say, for instance, their fatigue is terrible. They have diminished appetite, taste buds are awful, really struggling to sleep, nausea, vomiting. Say they're having all of these symptoms. So they come to palliative care because palliative care is trained, they are specialized in symptom management, pain control, symptom relief, holistic care. So they are focused on, like I said, the psychosocial, spiritual, emotional, and physical well-being. Your oncologist, who of course you're going to keep throughout the duration of treatment, your oncologist is focused on your cancer and treating your cancer, how the cancer has affected your lungs or your bones or your brain. That is their focus. That is what they went to school to specialize in. And oftentimes they will defer to palliative care because they see palliative care is focused on the whole person, and it's a very holistic approach. And we work so closely. So often as a navigator, if I have a stage 3 or stage 4 diagnosed lung cancer patient, I like to send them straight to palliative care because I know at some point they are going to need symptom management and need that extra layer of support. I know that caregiver can use all the support they can get. And it's just more holistic approach. So those are the differences in having an oncologist that focuses on treating your cancer, how the treatment affects your lab work, as opposed to palliative care, who looks at how the cancer, how you're responding to it as a person, how your body's responding to it as far as toxicities, how your caregiver is responding to it. It's just a different team approach. So the two together, they just come together as a double-edged layer, so to speak, a layer of support for not only the patient but the caregiver. And it's just, you see patients do so much better, have much better quality of life. They are better well-being, different focus when palliative care comes into play, but also the independence of the patient to feel like they are treating not just the cancer, but they haven't been forgotten as a person. It is so easy to see a patient once they're diagnosed with cancer as a cancer patient. People tend to forget, yes, they have cancer, but you know what? They're still a mom, they're still a dad, they're a daughter, they still work, they're still a nurse. So that palliative care team looks at that whole person. They're not just a patient, they're a person. And that caregiver is an essential part of the team. So you just have very different disciplines that work just so well together to make sure that patient gets the best quality of life they can have.
And I love the way that you explain that. Very, but it's the entire idea of survivorship care, right? And
Exactly.
that is something that as patients we embrace, whereas, maybe saying palliative care is something that reminds us of times when maybe we have lost loved ones to cancer because all they had was palliative care. So explaining it to a patient that this is whole body, patient centered type supportive survivorship care, all the good things, Angie.
Right.
It's all the good things. There is a hesitation there, and that's why I think that this topic is so important because people hear that. I mean, palliative care was used in our situation as end of life care. You know,
Right.
no further treatment options and end of life care. And now, you know, there are nutritionists and there are all of these people who are working to keep the rest of you as healthy
Right.
as you can be because fighting cancer is not an easy thing.
No.
So yeah, I absolutely am a huge fan and cheerleader of palliative care. So tell me how palliative care can help, like a care partner or a caregiver whose person's been diagnosed with lung cancer.
Well, it's funny the way you just put that out there about palliative care because when I talk about palliative care versus hospice, right out of the gate, I'm like, this is not hospice, this is palliative care, and explain very clearly the differences. And it's so important because people automatically hesitate. They think of death and dying affiliated with palliative care, and it's not that way. And once you can make patients and caregivers understand the differences, they're very open to the support of palliative care. I think the biggest thing for me with caregivers is seeing the relief that they get when palliative care comes into place. They are taught and educated about their loved one and why they're having these symptoms and what to expect when they have issues with toxicities caused by chemo, or what to expect when they're in pain and how to help that pain. You're literally giving them independence and how to help their loved one. When they're at home alone at 2 in the morning and their loved one is in pain, what do I do? Well, palliative care educates that caregiver. This is what you do at 2 in the morning. This is at the time when you need to call us. This is how you handle their nausea, their vomiting. When you see this amount of weight loss, this is when you communicate. So they truly train that caregiver to understand the signs and symptoms that that patient is displaying. And that gives them a sense of relief because it gives them some independent critical thinking skills, but they also feel like, okay, I can do this and I can help and I'm doing the right thing because I'm being supported and educated by the palliative care team. This is their specialty. And it was so rewarding to see patients come in, they're scared, their caregiver is scared. I don't think I can do this. What if the chemo does this? What if the radiation does that? And after a couple of visits, they are empowered. They feel good about it. They're like, okay, I can handle this. If I get sick, I do this. If I can't sleep good, I'll do this. And what is so wonderful about palliative care, it's specialty training. These guys have a focus on pain control. So combinations of pain meds, it might be something you're totally unfamiliar with, but the combination with something else might give you such better pain relief than just a simple one and done. I have patients who have neuropathic pain related to bone meds. I'll have patients who have nausea. Of course, anxiety. What cancer patient does not have anxiety? And sometimes there's combinations of medications that the palliative care team has been taught how to utilize. and the patient still has quality of life. They don't feel all dopey and groggy and lightheaded like a lot of opioids can cause. But the combination of meds that palliative care may prescribe, that combination may help with nausea, anxiety, and pain all at the same time. Instead of you taking 3 and 4 and 5 different pills, it's just a wonderful thing that they could piece all this together. And you learn so much when you work with a palliative care team, because you see meds they use in combination and you had no idea the impact when those were combined, what impact that can make for a patient, and how many different symptoms it could treat in one setting. And there and again, you're empowering the caregiver to know how to respond to those symptoms at home, and you're helping the patient understand what to look for when they need medications, what medications they're taking for what symptoms. It just makes a tremendous difference having that specialized team focused on your well-being.
I love that. I obviously, well, not obviously, but back in the 1900s when I was taking care of my dad, there wasn't anything offered to us. Had there been a palliative care team, it wasn't talked about and it wasn't offered to us. And I don't know if they got the sense that we didn't want to hear it, or maybe my dad had more time than and had less time than any of us knew. But it brings me a lot of comfort knowing that there's this team that is there to help, if not the patient, because, my dad would not have accepted the help, but the care person, the care partner, with all the things, because I had never opened a medicine bottle before. I did not know what all of the things meant, and that, you really do have to follow every single instruction on the bottle.
It makes a difference. I always tell the patient, like your dad, if a patient says, no, I'm not interested, and I'll say, okay, if you're not going to do it for you, why don't you do it for your wife, your husband, your son or daughter, the one that's caring for you? Because I bet they could use that support. It sure would help them to have someone supporting them so that they can help you. And when you turn it around on them, they're like, well, it's kind of selfish if I don't accept palliative care because I'm keeping this from my loved one. And so it's a little, psychological critical thinking you have to mess with. And usually once you get palliative care involved in the situation, the patient's like, oh, wow, I'm so glad you got this got me involved with this. And the caregiver, I've never seen a caregiver who turned down help or support. And I've gotten such a great response from involving our palliative care team with patient care. And, if ever a patient needed to transition to hospice later on, or if they chose to stop, forego treatment, there is a very smooth transition from palliative care to hospice and comfort only. So that is one thing to keep in mind, and it makes it so much easier on the caregivers
Yeah.
if you do have to transition to hospice. And that is something I always, try to make sure my patients, I emphasize that to the patients. You may not need this or want this, but your caregiver can use it. So, like I said, a little trick psychology, trying to get them the most support you can. Everybody deserves that comfort care and that holistic care. Like I said, you're not just a cancer patient. Yeah, you got lung cancer. That's not who you are. That's just something that you were dealt. You are still that person, that person who strives to be good, who has a family, who works, who, has the grandkids, has this career. People can't lose sight of a person being diagnosed, but still being a person, not just a cancer patient. And I know that is the most important thing I hear from my patients. They don't want to talk about it. They're like, I don't want to be seen as just a cancer patient. I'm still me. And I love palliative care just focuses on that person as a whole, not so much the cancer itself. They look at symptoms, and it's just a great thing. It's such a huge support. Obviously, I'm a huge fan of palliative care. I've just seen how rewarding the results can be when you get them involved.
So, spoken like a true caregiver with a lot of experience, I think. We definitely would have benefited from
Mhm.
just the education that I think palliative care would have brought to us.
Mhm.
I do know that it would have alleviated confusion with like pain meds and when to deliver those, and when to panic and when not to panic. I think those are things that they when you start this, they don't teach you those kinds of things.
Right.
There's that gray line of is it ER time or what's going on? And so there's that extra layer of education, I think, that comes with not only having a patient navigator, but, working with palliative care and, they know all your different symptoms and, maybe this is a new one and maybe this is not related to XYZ. And so I really like the idea of that. And as a former caregiver, it really would have alleviated a lot of fear and uncertainty for us, for sure.
It does make quite a difference. Some of the things I used to do in a patient's home, as I said before, palliative care may transition to hospice later, but setting them up with palliative care, whether it be in home or when they're in the clinic setting, getting chemo or treatment, just making sure they understand, like you said, this is what you should report that's related to the cancer. These are the symptoms. This, and making sure they know, okay, this right here, if they have this going on, that's not related to the cancer. That's a medical emergency that's totally unrelated. Signs and symptoms of a heart attack or a stroke. It's so easy to take those for granted because everything is related to the cancer. You see that so often patients get diagnosed and they'll have aches or pains. Oh, it's just the cancer. No, it could be some other medical emergency. Gosh forbid that you have that on top of having to deal with cancer and cancer treatment. So I would make sure that the patients and the caregivers had very defined lines of what to expect from treatment or what to look for with the decline or the cancer disease process itself versus what to look for outside of that, how to treat things, what medications to use, and you work together. Some patients or caregivers, they really needed a calendar. When do I give this? What if I give too much? Are you sure they can take this? The combination medications, and sometimes they needed simple written instructions as a constant reminder, and that's okay. Anxiety is a terrible thing. And like I said before, what patient is not anxious about a cancer diagnosis or a loved one having cancer? And those things promote comfort and well-being for the patient and the caregiver. Little things like that, things we take for granted until we're in a situation like that.
That's great advice. I am curious. Does the palliative care team do any sort of like when cancer ends type programs, or is it just during treatment?
So that's a good question. With our palliative care team, we have survivorship. So they might follow you after treatment. You certainly wouldn't need them as often unless you had long-term effects of treatment. With lung cancer, survivorship, we have support group. We also have cancer services. A lot of our lung cancer patients who go into remission will work with. just to keep their hands in the pot, keep their hands in the community, show other survivors, that they have beat treatment, that they have gone through that and come out on top. So palliative care can certainly do visits in the home. They can do inpatient visits, basic assessments. Of course, it's not as often as it would be if you were getting active treatment. A lot of patients, we would see them once every 6 months just to do a checkup, kind of like a fine tuning, check vitals and so forth, make sure the family is supported. And of course, heaven forbid, if a patient comes out of remission, then palliative care can pick right up where they left off. In some situations, a lot of other cancers might have a much more toxic treatment with long-term, lifelong effects. Certainly, palliative care can stay involved, and that would be a little bit different situation than your lung cancer treatments. Everything is so different, so individualized with cancer treatment. But those are questions to always keep in mind in any situation with palliative care or hospice. Hospice, ebbs and flows. I had folks that would outlive that 6-month prognosis, and we would put them back in palliative care because we wanted to keep them comfortable and focus on their well-being and goals of care. But you didn't want to leave them stranded in case they, progressed or the disease suddenly took a turn for the worse. So, pretty much you have options of having that palliative care support throughout any illness.
That is good to know. I am curious though, and you just talked about, chemo brain and brain fog. I just lost. What is wrong? Is it Friday?
I have my moments. I attribute it to mixing chemotherapy for 20 years.
Okay.
I can say I've got brain fog too, just a different kind of brain fog. You have those moments. So I apologize if I have those moments, you guys.
Okay, this is really serious. I'm not gonna laugh anymore. I might laugh. The month of May is coming to a close, but I know that there was some mental health awareness initiatives during this month. And I'm not really sure what it was, if it was, Mental Health Awareness Month, or if there was another way to say it. But we know that folks that get diagnosed with lung cancer and folks that care about people who have lung cancer or care for people that have lung cancer do experience anxiety and depression and all of those things. Does palliative care address mental health issues, or is that a separate thing?
No, absolutely. Palliative care addresses anxiety, depression, insomnia, panic attacks. I'd alluded to medications earlier. Working with the palliative care team, it was interesting to me that some of the medications they might use for appetite, didn't realize this, but also would be indicated for sleeplessness, nausea, vomiting, or appetite stimulation, overall improvement in fatigue, because fatigue is the number one dose limiting toxicity of just about any chemo. And they would, order this combination of medications based on the patient's symptoms. And instead of using 4 or 5 or 6 or 7 meds, there might be 1 or 2 pills when combined that would treat all these symptoms. And patients had no idea.
Yeah.
Yeah, I mean, it was fantastic because, a lot of my patients are young. I'm in my early 50s. If I had lung cancer, I've still got kids to finish raising. I've got kids in college. I have, a career. I would still have to work. And my patients want to work. They want to go to church. They want to do all the normal active things. And the first thing out of their mouth about 2 to 3 treatments in, wow, the fatigue is ridiculous. And it's not every single cancer treatment, but anyone knows, I don't have to tell you guys, fatigue is terrible. And I found our palliative care team has some little tricks up their sleeves where patients are like, wow, my fatigue's better. My focus is better. They feel like they have improved mental health because they're able to have normalcy by continuing to work, by feeling like playing golf with the guys or picking up the grandkids or going on trips. I have folks who will see palliative care around the time they have their chemo. This is my small cell lung cancer population. You guys know you come every 3 weeks for treatment. So they'll come in, see palliative care, and manage their symptoms, get their treatment. And by golly, they're going to the beach with the family on their 3 week reprieve. So if you can use palliative care to help manage those symptoms so that you can do those things, that is everything. Patients want that normalcy, and seeing folks utilize palliative care versus the ones who do not, such a huge difference in their well-being. But the mental health, feeling good, feeling like you can maintain your normal activities, you're not focused on the cancer. You're not focused on what's happening with your body as much as you're still focused on everyday living. Focusing on living, and I love that it's live long, because I always tell my support group, my cancer support group, it's called Living with Lung Cancer because we are living with lung cancer, and so often people mistake lung cancer that it's a terminal diagnosis. And 30 years ago when I became a nurse, they thought it was a death sentence. You got 3 to 6 months. Wow, you know what? And us, Dusty is living proof that a cancer diagnosis, lung cancer, there is so much hope, so many treatments, and that's why I'm so passionate about it, seeing the changes we've seen in lung cancer treatment. But palliative care just improves the overall well-being of the patient and the caregiver. Like I said, I'm so pro palliative care because of the benefits it gives to the patient and family.
Absolutely. And and I say this every time, you don't know what you don't know.
Right.
You don't know what kind of resources are in the community. You don't know what kind of resources are under the same roof as your treatment facility sometimes. You just, maybe one floor has no idea what the other floor is doing. But having someone that's dedicated to addressing those needs and those gaps and be your voice and your advocate, I think, is super important. So yeah, absolutely. Ask your doctor or your treatment facility about palliative care, not to stop treatment, but for supportive care services, what's available in your community. And this is so in your healthcare facility, and this is so much smarter than going down the block to the massage, the little massage place that's $50 an hour because you have this horrible pain where your lung cancer used to be. Your palliative care team is trained specifically to know what is okay and what is not okay for your body, and to look for things to be worried about. Not necessarily an hour-long massage. There is a big difference.
Well, and what's great about all of this, Katie, is insurance pays for palliative care. I have folks that are afraid that that's one more doctor visit, or is this part of my, care team? Palliative care is paid for Medicaid, Medicare, private insurance. And what's interesting, in some instances, if palliative care prescribes something that, even though it's holistic, often you will get a discounted rate through the insurance, or they may pay for so many visits. I always tell folks to, check their insurance, check on Medicare or Medicaid, because palliative care prescribes it. Sometimes the total cost can be covered. It really depends on what they're ordering. I don't think they cover acupuncture. In some cases, though, medications, counseling, massage therapy. In our situations, all of our dietitian services, chaplain services, of course, nurse navigation, all of that is free of charge. And so often patients, like you said, you don't know what you don't know. Patients don't realize those services are available or that palliative care is available, and they don't utilize those services. That's where a navigator comes in. Not to toot my own horn, because not every cancer center has navigation, although they should. But that is one thing I emphasize. We try to mitigate barriers to care once we get patients where they need to go. I see your scans. I see what's going on in your lungs. This is where you need to go. Once you do get diagnosed, then this is what we need to do to get you treated. That's what I do as a navigator, and making sure they know all about those services. And like I said, I try to get my stage 3 and stage 4 folks connected with palliative care right out of the gate. And always emphasizing this is not hospice, this is palliative care. There's such a difference. Those support services, I tell everyone, ask what's available at your cancer center. What do you have that can support me and my caregiver? That is such an essential part of their well-being.
Mhm. So, see, everyone needs an Angie at their hospital. Absolutely, I'm not joking. It's absolutely it's imperative to ask for these things, and I've seen so many
Absolutely.
times patients who are afraid to ask for these things,
Right, right.
or let me give credit back to our hardworking healthcare providers. Maybe you told me about all of these things, but for the last 3 or 4 days I've been trying to digest that now I have cancer, and what am I going to do, and how am I going to pay the bills, and how am I going to do this and that. I was not listening about your resources.
Right.
But I may go down the street to a live long meeting, or, a walk, or something somewhere, bump into somebody in the elevator, and I learn about your in-person support group, or I learn about, activities that you guys have going on, or the palliative care services that are there. So yeah, I think, it's so important for us to keep talking so that people know and that people can ask, right? Um,
Absolutely.
I always change that whenever people are like, can you look at this? They're editing something, like, can you look at this? And it's always your doctor, blah, blah, blah. And I'm like, ask your doctor.
Absolutely. Empowering a patient, that is one thing a navigator strives to do, is empower a patient. I can preach, toxicities to chemo. I can educate you all day long about side effects of radiation. I can tell you everything that I've seen in the past 30 years that's related to cancer treatment, hospice care, palliative care. You know what? I cannot tell you how treatment and cancer is going to affect you personally.
Oh, good point.
So, and I share my experiences with patients. I never sugarcoat anything, because patients, especially this day and time, they want facts. But how many generations, and my dad was one of these, how many generations were like, oh, the doctor is right, and if I needed this, the doctor would have told me? Where your younger generations, they're like, oh, no, 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 no. I know there are resources out there. This is where do I find them? Big difference. And so, one thing as a navigator, and, my counselors and my chaplains, we strive to make sure this patient knows about the resources. And yeah, you're right. The anxiety overwhelms them. Sometimes you just have to repeat it over and over. And one of the things I do every time I see a patient, from the start till finish, or till maintenance or survivorship, what do you need right now? They may not need a thing from me. They may have read all the books I've given them, stem to sternum, but they might need something simple. Patients, they wax and wane. They might be breezing through treatment, but did their granddaughter go in the hospital for something? Did they lose their spouse? Did they get in a car wreck? Recently had a fella got in a car wreck, headed to treatment. And gosh, did that flip him on his head? Because now he's dealing with the aftermath of that car wreck. And he's terrified of his lung cancer going awry while he's going through this. So it's education. We're still educating him about the disease process of cancer, and while the orthopedist is trying to work on that broken bone from that wreck. So that patient still needs that love, that TLC, that support, and that education, because patients go through so much more than just lung cancer. I wish, that's enough. A patient shouldn't have to go through that. You would think, well, that's enough, Mother Nature, leave me alone. But they go through so many other traumatic events in their life, and lung cancer just adds to that. So supporting them in every way possible, and palliative care and nurse navigators, those are things work hand in hand with that oncologist who's treating them. So that's my spiel. I'll be glad to answering questions or try to connect people. I could do rent a navigator. Maybe I could go cancer center to cancer center and make sure everybody has a navigation team and a palliative care team. That's what I could do. I would love it.
That would be fantastic. Train them up. You have
it.
they're able to walk patients from from beginning all the way through to survivorship or after cancer care. And I'm telling you, it would lower anxiety. It would lower stress. They would feel really cared for, I feel like, and just all the touch points and the checking in and all of the different specialties within palliative care, I think are huge value. And I think it's something that's really not talked about enough. So I'm glad we talked about it. Before we go, because we could talk about this for days, I want to talk about, you said, your palliative care includes chaplain services. What does a chaplain do in that instant? It's, in my brain as someone who's never had palliative care, and you talk about, chaplain services. This is either someone that's going to pray with me because I'm a prayer, or someone that's going to pray for me because I'm dying. What does he do?
No, that's a great question. We have an awesome chaplain that I work with in our particular cancer center. She actually held my dad's eulogy. That's how much I love her. She is wonderful, as were the chaplains I worked with at hospice palliative care, which is when I did the home health in-house. But being in the cancer center I'm at now, Andrea, of course she'll pray with the patient. She will address their spiritual concerns. The coolest thing she does, she's just there. She walks in a room. She's this calming, caring presence. And it's funny because she comforts and calms me in a very desperate or dire situation. Sometimes she is the go-between the patient and the caregiver, because there's so much anxiety, and sometimes there's some family trauma or unusual dynamics. There's no such thing as the Leave It to Beaver Brady Bunch family. Sorry, guys, there's no such thing. And sometimes there's a lot of different dynamics going on. She kind of mitigates those fears, and she's very calming. So those are things the nurse navigator or the oncologist can focus on the patient, while Andrea is trying to calm and focus on the family and caregivers and try to mitigate that anxiety. Our chaplain has her notary and a specialty. She's got multiple degrees, but one of the things she focuses on is advanced care plan. Having the advanced care directives. People don't like to talk about that. Guys, let me tell you, I've had my advanced care directives in place, my power of attorney, healthcare power of attorney. I've had that in place since my late 20s. I'm an only child. I want, my husband to speak for me. Now that my daughter is 21, she would be second in command because my kids and my husband, they know what I do not want if I couldn't speak for myself. I don't care if you have the illness. I don't care if you don't. It is so important in any circumstance to have those advanced care directives done. Our chaplain helps with those. And for the most part, I think most chaplains, that's one thing they're well versed in. Palliative care definitely is well versed in that. That is part of their focus is goals of care. And then Andrea will pray with people. I've seen her baptize people. Doesn't matter what faith, what religion, what ethnicity, and you can be agnostic or atheist. It's not about, essentially a spirituality, and everybody is spiritual on some level. So it's been great working with a chaplain. In any situation, she tends to just be a comfort, a source of comfort.
I love that. And again, it's something else that we can talk about for another 2 days. um, uh, I just learned recently how underrepresented spiritual needs are in cancer care and in the healthcare system. So I love the idea that you have your person there, and that they're dedicated to really just helping a patient during this time. So is it only inpatient or is it outpatient too?
No, actually, when I did home care with hospice and palliative care, we had chaplains that would come into the home with us, actually during admission even. And of course, if there was family trauma, family dynamics, the ebb and flow, they could go with us as hospice nurses in the home health situation. As far as inpatient, our chaplains, we do have a group that are inpatient focused. But Andrea, in our case, she is outpatient. So she belongs to us. She's our chaplain that's there on site. And like I said, it's such a blessing. I have found I was brought up in a very strictly religious Baptist church. And if people are familiar with that, they know what I'm talking about. Well, interestingly enough, here in the South, we have a lot of Catholic population now. We didn't have that when I was a kid. And it's interesting that I'll have patients who maybe once they moved from the South to the North or to the North out West, they kind of lost touch with their religion and started questioning when they got their cancer diagnosis. And that's been very interesting. One that comes to mind, she said, I haven't thought about religion in years. And now, I'm kind of facing this cancer diagnosis. And maybe I should get back to that religious belief. Or, her spirituality had changed. And she wanted to reconnect with her spirituality and not so much the church or the family of her church, but she just was looking for answers, and was thinking back to her childhood and the beliefs of her youth, and just having that chaplain there to just talk to. Andrea, of course, would never tell you what to think or how to think, but that calming presence, or if someone wants to talk about the passing of a loved one, or if they're fearful because the diagnosis has changed to a stage 4, or you have a limited prognosis, those spiritual needs are so great, and sometimes they're greater than the physical needs of the patient. And I think too often we do not address those spiritual needs.
Yeah.
That's important. So I'm obviously a huge fan of chaplain support. I think it's good for any patient. Like I said, whether you're agnostic, atheist, Muslim, Buddhist, Baptist, Methodist, Catholic, Jewish, everyone, there's a spiritual side to us all, whether it's religious or not. And, those need to be addressed and met.
I agree. I agree. And also just the very basicness
Mhm.
of being able to talk to someone that's not a family member or friend,
Right.
someone who doesn't know you, where you might be able to be
Mhm.
very vulnerable
Right.
and share these things that you maybe wouldn't share with your person. And that goes for
Absolutely.
caregivers too. I can't tell you how many conferences I've done, and I'll ask a caregiver question, and they all just sit so politely and so still next to their person. And I know, we're just gonna have to have breakout, and you guys are gonna have to split up if I want the truth.
And that's
So,
true. I find it interesting that I've had patients get diagnosed, newly diagnosed, and someone starts testifying to them about a particular religion. Now, understand, I'm always grateful for someone who cares about my soul because Lord knows someone needs to. I am grateful. I would never, say anything bad. But it is interesting to me how someone will immediately start testifying, and it's overwhelming to patients sometimes, and it makes them fearful in some instances, certainly not all. And I find that, they'll reach out to me or the chaplain, and the chaplain gives them permission to process through that, to process through the teachings of their youth, to process whether they feel they should change religions or go back to their religion or return to church. It's interesting, like you said, they don't want to talk about it, maybe in front of their caregiver or their pastor, but yet they still need a place to process.
yeah.
They're scared of being
Sometimes,
judged sometimes.
yeah, sometimes I know my dad in my case would never have told even his doctor anything for fear that his doctor would take him off treatment
Mhm.
for any
Oh,
reason.
absolutely, we see that daily.
Yes. Yes.
Absolutely.
Yes, so having someone else, a different party that
Mhm.
understands what you're going through, but that's also a safe person to
Mhm.
maybe talk about these things too, and they have experience as well.
Right.
To maybe talk about what those feelings are, because there's a lot of big feelings around all of that stuff. So,
Mhm.
well, oh my gosh, Angie, we went overtime today. I'm a big fan of palliative care too.
Yeah, I
Um,
am. I am.
I absolutely, myth crushing the fact that people think that it's only end of life care. That's part of the puzzle, but it's not the whole puzzle. So yeah, I appreciate it. And I know our folks, some of them were gearing up to go to some big science meetings. Uh,
Nice.
Starting up soon, and there's some in-person advocacy trainings and all that good stuff. So I know that several have said they're going to watch this later. So I'm talking to you guys that are watching later, and you guys that are watching now that have been really quiet. If you have questions, put them in the chat or email them to me at katie@livelung.org. I will make sure to get those in front of our nurse navigators. And who knows, it might be the next topic that we talk about. All right, Angie, it's been great. I hope you have a great week, and we'll talk again soon.
Bye, everybody. Thanks so much, Katie.